this?
Help me.
If so, you've come to the right place. Dr. Perkins is here to help you. With tips and explanations that will not just help you learn the information, but master it for years to come. Alright guys, today we're going to be talking about Prazole, also known as Omeprazole. Notice this ending, Prazole, right? It sounds like you're saying Prazole, right? Why? Your heartburn is gone, right? So, Prazole, my heartburn's gone. When you see that, it lets you know that this is a proton pump inhibitor. And the way this is going to work is it's going to shut down the ability of your stomach to make acid. Alright, so why do you take this drug? In short, to control the acid level, right? So GERD, you got acid splashing into your throat. It's going to burn, very painful. So what's going to happen is we'll make it where the acid isn't so strong. And so when it splashes into your throat, instead of a level 10 pain, you only get a level 5 pain or 4 pain. Alright, with healing this gastric ulcers or the esophagus, right? We're not fixing the problem. But what we're going to do is, let's say you're on a medicine that's going to kill the bug that's causing these ulcers or the esophagus, but now because your stomach acid is so strong, now this mucosa, this lining of the esophagus or the stomach, has a chance to heal. Zollinger Ellison Syndrome. So what happens is you got this tumor that's telling your stomach, produce acid, produce it like crazy, we need more, right? And so we don't need all that acid. And so this is going to shut down the ability of the stomach to respond to those signals. Alright, so off-label uses. So you can use these drugs for these things, but it's not approved by the FDA, right? So for example, you're taking NSAIDs. Let's say I hurt my back and I'm constantly having to take pills to manage the pain, right? And so I don't want to get an ulcer here, and so you can use this in that case. Alright, now the FDA hasn't approved it for that, but a lot of doctors use it. GI bleed, right? Or bleeding into the stomach or the esophagus, whatever. If there's not as much acid there, generally I'm better able to form those blood clots. Alright, so what is the mechanism of action? How does this drug work? It shuts down the proton pumps. What do proton pumps do? They pump protons, that's a fancy name of the acid particle, from our blood into our stomach. The reason why your stomach is acidic and your blood isn't is because our blood has roughly the same number of acid and base particles floating around in it. The stomach, we're just constantly pumping all these acid particles into it. And so the stomach's going to become more and more acidic until it can digest your food. We're shutting those things down, and so your stomach cannot be as acidic. Okay, so what is the route of administration? How is this drug getting into my body? Well, you can do it a couple of different ways, right? Orally, right, you're putting pills in your mouth, and that range is going to be pretty big, right? It depends on why you're taking this drug, but anywhere from 25 milligrams to 2,000 milligrams a day. Now, what happens if you need to take this drug IV? Well, when you take it by mouth, not all of it gets into our system. And then on top of that, the stuff that does get absorbed, your liver breaks down some of it. So at the end of the day, if you put 2,000 milligrams into your mouth, only 1,000 milligrams is actually able to get to our bloodstream and able to work on the stomach to stop you from producing that stomach acid. Well, if I'm getting the drug IV, I'm skipping all that. I don't need 2,000 milligrams by vein. I only need 1,000 milligrams. So whatever your dose is by mouth, cut that in half, and that's how much you're going to get by vein. That's how much you're going to get in an IV. Okay, so if you're on this drug, you need to taper it over 2 to 4 weeks. Well, why is that? Well, take a look right here. We got 5 proton pumps, and they're producing 4 acid particles apiece for a total of 20 acid particles. Now we take our medication, and now we're only having 8 acid particles working. Why? Because we shut down 2 of the acid pumps. Alright, now day 28, what happens? Well, our body doesn't like only having 8 acid particles, right? It says, whoa, okay, we got a problem here. And so what happens is the body signals these acid pumps a lot harder, right? And so you can see there's been a dramatic increase in the number of signals going to these acid pumps, and the signal is gastrin. And so if you're on a proton pump inhibitor, your gastrin levels are going to rise. And so now, instead of just producing 4 acid particles, they're producing 6 acid particles. So now we're up to 18 acid particles. So what's going to happen if you say, this medicine doesn't work, I'm just going to stop taking it? Well, what's going to happen is because you have so much more gastrin in your system, and it takes a while for that gastrin level to go up, and it takes a while for it to go down. If you were to stop taking the medicine like that, these proton pumps are still going to be working at full bore. And so you're going to produce way more acid, and your heartburn's going to be way worse than what it ever was before. And so no, you don't stop taking it altogether, just overnight. You're going to slowly but surely kind of wean yourself down so you don't run into this situation right here. Alright, so what are the side effects or adverse reactions? Now remember, a side effect isn't that the drug's not working. No, it's working in a way that we don't want it to. It's doing something that we don't want the drug to do, right? So we're taking our proton pump inhibitor to treat our GERD, but it's doing something we don't want it to. It's giving us abdominal pain, diarrhea, vomiting, headache, farting. A fancy name for farting is flatulence. Respiratory symptoms, so cough, sneezy, running nose, that sort of thing, or fever. Now, those respiratory symptoms and fever, you're going to see that more in peds. Alright, so what are the precautions? So we got this alarm going off, whoop, 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 right? Warning, warning, doesn't mean you shouldn't do it. It means you need to think about it. Alright, so what do I need to think about? Well, I might be having cancer, but because I'm taking this medicine, I feel really good. Man, that life is going great. Well, no, it's not. Your cancer's getting worse, but now you don't realize it because you're on medications. So watch out for this. The other thing is atrophic gastritis with long-term use, right? So your stomach gets inflamed and kind of shrivels up a little bit. Increased risk of C. diff. One of the big helps of our GI system, our stomach especially, that strong acid is going to kill the germs. Well, if I'm shutting down that strong acid, it's a lot easier for the germs to get through and cause problems. Bone fractures. They don't fully understand this one, but you're more likely to break a bone. Decreased clopidogrel activity. That's a major precaution right there. Why? I'm taking this so I don't have a heart attack or stroke, right? And now you're telling me my medicine doesn't work as well? Okay, so you're definitely going to have to, make some adjustments here or think about it. Low magnesium level. St. John warts or rifampicin is going to affect how these things work. And it's going to interfere with drug testing for neuroendocrine tumors. And once again, you're worried about me having a cancer and you do the test and it doesn't work as good, you're more likely to miss it, right? Or, at bare minimum, you have to think, okay, look, I can't do it this way, let me test this other way instead. But yeah, all these things should say, let me think about this. Alright, these are contraindications, right? This is a no, do not give this medication, right? You're gonna find out, either you have any sort of allergy to a Prazole or a benzimidazole, right? With that benzimidazole, you're gonna have to do a little bit of digging to find out if the drug they had this serious reaction to was a benzimidazole, right? That can be used in any sort of thing. Otherwise, you might be playing this song in your near future, right? Don't want to go down that route. So don't let that be you. Look for these contraindications. Alright, so what should you be doing as a nurse? Well, you're going to give this medicine before meals. You can open up the capsules right there, but you gotta be careful, right? If you're going to open it up, you're going to mix it with something acidic. And the reason being is we're going to protect that enteric coating. Alright, now you can mix it with apple juice, you can mix it with yogurt, and give it immediate. You're going to monitor for a B12 deficiency. Now be aware, it can take about 3 years for this stuff to show up. Alright, and then long-term use can increase rate of gastric carcinoma, a type of cancer. Alright, patient education, no alcohol, no NSAIDS. Don't chew or crush the pill. Why? Because these tend to be released over time, right? And then on top of that, they have that enteric coating. And so if you're crushing these things, you're defeating those purposes. Alright, so take prior to meal, only with water. Look for black tarry stools, abdominal pain, or diarrhea, right? This can be a sign of a GI bleed. And then notify all doctors about this medication. Why? Drug-drug interaction. And if you're pregnant or think that you may become pregnant, you gotta tell your doctor about this because we don't want you taking this while you're pregnant. So here's your NCLEX style question. Your patient has GERD and the following symptoms: blood in the stool, frequent vomiting, pain when swallowing, chest pain. He went to the emergency department and had a negative cardiac workup and was given a GI cocktail, and immediately his chest pain resolved. He was started on Prilosec OTC, now feels much better. How should you best educate your patient? Number 1, the treatment is obviously working, so continue it. Number 2, do not abruptly stop the medication as you can have rebound response. Alright. Number 3, if you take Tums, it will enhance your response. 4, you should talk to your doctor about your ER visit to ensure that you don't have anything more serious than GERD. Or 5, be sure to chew your medication thoroughly before swallowing. Take a minute to think about it. Okay, so let's look at these answer choices and go from there. So continue the treatment as it's obviously working. Okay, if they have severe chest pain and all these problems and you take the pill and all those problems go away, usually you're not going to have to tell them to take it, right? What you're usually going to have to tell them to take is, I feel fine whether or not I take my pills. Why am I taking these pills? This is stupid, right? And then they have a heart attack or stroke because they're not taking it. Those are the sorts of things where you usually have to tell them, hey, keep taking it. Okay, don't abruptly stop the medication as you can have rebound. That's not a bad thing to tell them. Alright. Number 3, if you take Tums at the same time, it will enhance the response. Okay, here's the problem. If you're taking Tums at the exact moment you're taking your proton pump inhibitor, Tums is going to be basic and it's going to damage that enteric coating, and so you're more likely to destroy your medication. That being said, if you've already taken your proton pump for the day, and then, let's say it's 4 hours later, you take Tums, that's not going to hurt. That will help them. Alright, number 4, you should talk to your doctor about the ER visit to ensure that you don't have anything more serious than GERD. Alright, well, what could it be? You've already ruled out a heart attack. Well, it could be something very serious. So all the signs and symptoms that he's having are signs of Zollinger Ellison Syndrome, right? And so this man literally could be dying of cancer, and because he feels better, right? Man, this stuff works great. I don't need to go to the doctor. I'm cured, right? No, right? He's on his way to a casket. And so that's why he absolutely needs to be checked out by his doctor, right? 2 is pretty good advice, but 4 is absolutely going to trounce that, right? There's nothing more serious than, hey, look, we got to make sure you don't have cancer. All right, number 5, be sure to chew your medication thoroughly before swallowing. No, you don't chew before swallowing because it's going to destroy that enteric coating, and now it's not going to work so good. Your patient Bob has been on Prilosec for 4 years and has recently been diagnosed with Alzheimer's disease, optic atrophy, and diabetic neuropathy. How could you best advocate for your patient? 1. Find the best nursing home that will work with its insurance. 2. Ask the doctor if an insulin pump coupled to continuous glucose monitoring would improve his glycemic control. 3. Remind the doctor to talk to the family about changing his code status from full code to DNR. 4. Give the family reminders about diabetic exams. 5. Ask the doctor to check for a B12 level and possibly prescribe B12. Or 6. Remind the family how to check the patient's blood sugars. Give you guys a second to figure it out. We'll go from there. Alright, so let's look at these options and see what the best answer is. So, find the best nursing home that will work with this insurance. Okay, once you put somebody in the nursing home, you're kind of looking at towards the end of life situation here. Alright, doesn't mean people can't live long lives in nursing homes. I've seen people live several years in nursing homes, but on average, they don't have much time left when they put them in the nursing home. If we can keep them out of the nursing home and have a higher level function, that's going to be much better for them. All right. 2. Ask if an insulin pump can be coupled to continuous glucose monitoring to improve glycemic control. That's a pretty good option right there, right? That would definitely help with his optic atrophy and his diabetic neuropathy, right? It can help with those things. So possibility, let's take a look at those. All right, 3. Talk to the family about changing from full code to DNR. Okay, this question is based off, that option is based off of a faulty foundation, right? You're going to talk to the family about, hey, do you want to change his code test? Not, do you want to make him a DNR? No, right? So you're going to talk to the family, you're going to give them more options and say, hey, look, your dad, he doesn't even know whether or not it's in the morning or the evening. Do you still want him to be a full code, right? If you want to, we'll absolutely do everything we can for him. But if you don't, you gotta let us know, right? And that would be a more appropriate conversation here instead of, hey, let's make your dad a DNR. All right. Talk to the family about diabetic exams. Okay. That's never wrong to do, those diabetic exams. But what's going to happen is when they make their routine appointments, the doctor should be doing that as well. All right. Ask the doctor to check a B12 level and possibly prescribe B12. What? That seems a little bit off the wall here. Well, it's not as off the wall as what you think. So, how long has he been on Prilosec for? 4 years. Okay, well, why do I care about that? Well, Prilosec stops you from being able to absorb B12. Now, our body does store some B12. And so if you've been taking Prilosec for about 3 years, you can pretty much run through all the B12 in your body. And so now, because you lack of B12, you can, what's going on? I'm not sure, right? You get confused. Oh, Alzheimer's disease. Well, no, it might not be Alzheimer's disease. It might just be B12 deficiency. All right. It can also cause optic atrophy, so color blindness, and maybe loss of vision. All right. And then last but not least, it can cause numbness and tingling in the hands and feet. Well, if you have somebody who's a diabetic that has numbness and tingling in the hands and the feet, the first thing you gotta think of is diabetic neuropathy, but it might not be diabetic neuropathy. And so, once again, you're gonna check for that B12 and prescribe them. Why? Because if that B12 is low and you gave him B12, out of nowhere, his Alzheimer's disease might go away. His diabetic neuropathy might go away. His optic atrophy may go away. And that's going to be the most powerful thing you can do for that patient, is maybe make all his problems go away, right? That's pretty awesome. All right, number 6, remind the family how to check the patient's blood sugar. All right. At this point in time, they've probably been doing it for a while, but it doesn't hurt to just dot your I's, cross your T's, make sure they know what they're doing. But the most important thing is going to be that number 5, right? We want to check and prescribe that B12 level. As a nurse, you are not a doctor, but you are an advocate for your patient, right? And so you need to know what's going on and be able to advocate.